Are you pregnant and wondering what the heck is a non-stress test and what are they even looking for when you do one? We're going to break that down in this video. I'm Roxanne. I'm a labor and delivery nurse and student midwife, and I'm going to be breaking down what exactly is a non-stress test and why do they even do it during pregnancy and labor. The non-stress test is one of the most commonly used tests during pregnancy to assess how well baby is doing in this moment. It doesn't necessarily give us an indicator of how well baby is going to be doing outside of this moment, but it's a sign that baby is well oxygenated at this moment and is doing well. And we're looking for three different things. So first, we're looking at baby's heart rate, and we want to know the baseline. So what is it, the average number that it's kind of basically staying at? So if this is a fetal heart rate tracing, we want it to be between 110 and 160. And so it's like the highlighted portion on our fetal heart rate tracings, 110 to 160, and then whereabout is it average? The next thing that we're going to be looking at is what is the variability. So the variability of a fetal heart rate is the beat-to-beat changes, because at any given moment, the heart rate's going to be slightly different than it was before. We want this beat-to-beat change to be at least 5 beats difference above and below the baseline of our fetal heart rate. So between 5 and 25 ideally. So this would indicate moderate variability if it was a beat-to-beat change of 5 to 25. If it's less than that, it would be called a minimal variability. If it was greater than that, it would be marked variability, which are two concerning things that we would need to investigate more. And then the most concerning variability is absent. So there is no sort of change. Beat to beat, it's just constant. That is not ideal. And then the last thing that we're going to be looking for on a non-stress test is an increase in the fetal heart rate called an acceleration. This acceleration needs to be 10 to 15 beats of an increase from the baseline for at least 10 to 15 seconds. And this is dependent on baby's gestational age. So if baby is less than 32 weeks, we want a 10 by 10 acceleration, which just means that it increases 10 beats above the baseline, stays for 10 seconds before returning to the baseline. If baby is above 32 weeks, then we want what's called a 15 by 15 acceleration. So again, increases 15 beats above the baseline for at least 15 seconds. And we want 2 accelerations during the non-stress test. So the non-stress test can take 20 to 40 minutes. We look at baby for at least 20 minutes. And then if we don't get those accelerations, then we have up to 40 minutes to get those accelerations. And the reason we give babies 40 minutes is because babies will go through natural sleep cycles, just like we do. They sleep a little bit more, just like when they come out. They're always in napping as a baby. So they go through these different sleep cycles where they're naturally going to go into minimal variability potentially. So if we catch them during those sleep cycles, we're not going to be able to accurately assess that and see that moderate variability as well as those accelerations. So if we give them the full 40 minutes, we have a chance where we're going to at least see them outside of that nap window to be able to assess their well-being. With the non-stress test, contractions are not required to be able to assess how well baby is doing. And that is why it's called a non-stress test, as opposed to another test we have is called a contraction stress test. And this is where we induce contractions, or if you are already having contractions, we can assess how well baby is going to be able to withstand the stress of labor and contractions. So anytime you come in for labor, you are getting what's called a non-stress test on paper, but it's actually a contraction stress test because we're being able to see how well baby is going to do to those stresses of the contractions with their heart rate. If you're getting a non-stress test and we haven't yet seen those accelerations and it's been 30 to 35 minutes, one of the tests that we can do is we can take this vasoacoustic stimulator and place it on your belly, and then it's what calling vasing the baby. So we're stimulating the baby by emitting a sound onto your belly. So it kind of vibrates and sends vibrations to the baby. So if they are sleeping and maybe we just caught them during their entire sleep window, this will wake them up and we should see accelerations after we do this. And this is again a sign that baby is doing well. This is an option that some people will still utilize and some people won't utilize because they think it might be falsely stimulating the baby when in actuality they may need to move towards induction. And this is giving us a false sense of reassurance that baby is not doing well. Whereas other people think that, again, baby was just in their sleep window and we need to make sure and wake them up to make sure that they are actually doing okay. An NST or a non-stress test, again, is done anytime you come into triage, especially if your baby is past 24 weeks. And it's also done during prenatal visits for someone who is high risk. It can take up to 20 to 40 minutes. And this is where we're looking at baby's fetal heart rate for three different things. We're looking at the baseline to make sure that it's between 110 to 160. We're looking at the variability because we want that moderate variability. And then we're looking for accelerations. And this is what we would call a reactive tracing. And baby is doing well in this moment. This is very reassuring for us that baby is okay to continue pregnancy, and then they'll just work with you on whether or not you come back for further testing or if we just send you on your way. With the non-stress test, again, we do not need contractions. If you have them, that's great, but it is not required, and we're not going to stimulate contractions using Pitocin. Versus the contraction stress test is a test where we're doing, again, all of these things, but also looking at the contractions and how well baby is tolerating those contractions. During the non-stress, normally we have to have the monitors on your belly, and they need to be connected with bands, or sometimes I'll have a full belly band when we're listening to the baby's heart rate. But if you need to get up and move, especially if you're having contractions while we're doing this test, you can get up out of the bed. You can move around however feels comfortable. As long as we're still able to hear baby's heart rate and see baby's heart rate on the monitor, that's totally fine. Sometimes the bands can be a bit uncomfortable for people. They can be a little bit too tight. So you can work with a nurse to find a way to keep the belly monitors on your belly in a way that's more comfortable and tolerable for you. If you had non-stress tests during your pregnancy, let us know how your experience was in the comments below. And if there's a topic that you're wanting to learn more about from us, let us know in the comments below and we'll be sure to make a video on it. If you enjoy this video, please like and subscribe to our channel so you can be notified whenever we release new videos. We release 2 educational videos a week and 1 fitness video a week. And if you're pregnant and looking for more support from us, check out our online childbirth education course and our prenatal fitness programs. Our childbirth education course breaks down the science of labor and birth, as well as different positions and labor comfort techniques that you can use throughout pregnancy, plus so much more. We also have our prenatal fitness program that's available in 2 different variations, our app-based program and our on-demand version. And then we also have mini versions of our app-based program. And all of these can be bundled together with our prenatal fitness programs and our pelvic floor for prep birth. And we even have a birth prep on-demand program as well. So we have lots of different ways to support you during your pregnancy with education, as well as movements to be able to have a pain-free pregnancy and be strong for labor and birth. And you can check out all of those offerings at mamastayfit.com and use code YouTube10 to get an additional 10% off any of our classes.